Welcome to another Founder Wisdom Pod. We have Bianca Skilbeck with us. She's the founder at Freedom for Food. We're going to talk about food addiction, psychology, self-help today, anything in between. Hypnotherapy would be a fun topic too. This pod is presented to you by podfire.com. That's my podcasting agency. If you want to start a pod, scale a pod, monetize a podcast, you can go to podfire.com. Bianca, welcome to the pod. Tell me a bit more about yourself and Freedom for Food.
Hi, Charles. Thanks for the invitation. And thank you for the introduction as well. So my name's Bianca. I started my business Freedom from Food almost 10 years ago now. I'm a specialist in the eating disorder space. So that means that I see clients who experience everything along the spectrum from disordered eating, yo-yo dieting, body dissatisfaction, all the way through to diagnosable eating disorders. As I say, I've been doing this for about 10 years now. I originally studied as a counsellor and clinical hypnotherapist, and I use both of those things in my practice these days. And I'm also just in the last stages of completing my psychology degree. So that's a bit about me, both professionally and personally.
Pretty cool. Yeah. Eating disorder, I have some of that in my family. I think a lot of humans do. I mean, food is so readily accessible nowadays, and anxiety is skyrocketing. So, like, humans are looking for ways to de-stress themselves and to fall into patterns that they think might lead to happiness. Sometimes it is the case with food. In my case, yeah, I feel I've done OMAD diet, so 1 meal a day. I've done keto and all of these things. Pretty disciplined when it comes to food. Also, food is like more than food. It's like social and really modifies your biochemistry once you eat something. Just the dopamine and the endorphins is pretty high. So if you could start describing, yeah, like food addiction and typical case studies of clients you work with, that'd be helpful.
Okay. Yeah, I think you've made a lot of really astute observations there that, food is not just kind of one thing in our lives, is it? It's a very multifaceted topic. It plays a lot of different roles in our lives. There's lots of different ways that we can eat, and there's lots of different ways that we can have a relationship with food. And all of that exists along the spectrum, I suppose, from what people might typically consider as like a food addiction, as you say. And I guess we're talking there about things like binge eating, compulsive eating, all of that sort of thing, all the way through to using food as a control mechanism. And that might be more things like, the restriction, the reduction, the limiting food groups, all of that sort of thing. And it ties very closely to I think a lot of emotions and beliefs, about food, and beliefs about how much we can control our lives versus let go and let our intuition, be present with this sort of thing. So I guess we can start in a couple of different ways here. I mean, I can give you my thoughts about food addiction first off, if you like, and then maybe we can talk about a case study. Does that work for you? Perfect. So in terms of like the food addiction label, it's actually not a label I use, and that's because I see food as something that we actually can't be addicted to. I mean, it's sort of, for me, that would be like saying, I'm addicted to breathing air or drinking water. I don't believe that we can be addicted to something we actually need to engage with. It's different if we're talking about something like alcohol or drugs or, gambling, things that, we can switch it off. We don't need it. If we find it difficult to moderate, we can just kick it out of our life. Food is something that you have to engage with at least a few times a day, usually, for most people. And so in that case, I don't see food as being an addiction for people. Rather, the addiction is often in dieting. And what I mean by that is that a lot of people who end up finding themselves out of control with food, so they end up on the more compulsive binge eating kind of spectrum of things, often, almost always, you will find that those people have a pretty heavy history of restriction. So there's maybe been a lot of dieting, a lot of simply not eating enough in their lives, a lot of telling themselves, that certain foods are bad, that they are bad, that they need to lose weight, that they need to control this better. And it's actually quite basic reverse psychology. When we restrict ourselves and try to, knuckle down and white knuckle our way through our relationship with food, this is when that inner rebellion comes out for a lot of people, and we can swing over into the binge eating kind of spectrum of things. And so a lot of people, whilst it's a very understandable feeling that they are addicted to food, it's actually coming from a place of a restriction mentality, and that's where it's coming from. So that's how I see things when it comes to the food addiction conversation. And so, to give you an example of that, I mean, I might not talk about a specific client right now, but maybe I'll talk about, I guess, like an amalgamation of a typical client that I might see. And I do see a lot of people with binge eating as part of their presentation. And they will often come in and maybe there's some weight disturbance or weight dissatisfaction. Maybe they're unhappy with their body image. Maybe they're telling me that I would like to lose weight. I've been trying, so hard for so long. And I say to them, tell me about how you're eating. And they'll start describing a typical day of food, and they'll first go to the thing that they think is the problem. They'll say, well, at night times I just can't control myself. I've gotten through a day of work, and I've got food that's prepared, good decent meal, but then I just get home and I don't even want that, and I order Uber Eats, and then I order something more, and then I go to the cupboard and I keep going back to the cupboard, then the fridge, and they start describing what they feel is the problem. And I said, well, tell me about the rest of your day, though. What did you have in the morning when you first woke up? Oh, I just, had a coffee. Okay. And then so you went to work? Yeah, I went to work. And, did you eat something for breakfast at some point? No, I don't usually eat breakfast. Okay. And then what about lunch? What happens for lunch? Well, I didn't bring anything for lunch. I'm trying to limit, how much I'm eating. So, I try to, usually just have something small, or maybe I just buy something small. And they basically describe a pattern of restriction throughout the day where they're eating very minimal, calories, because they have this weight loss goal and this feeling that, well, last night I ate too much, so why would I eat this morning? And it just becomes this vicious cycle, essentially. So that would be the amalgamation of like a typical client that I might see who feels that binge eating or compulsive eating is a problem for them. But as we start to unpack it, we see that there's a lot of restriction and a restrictive mindset around food happening. And it's just that rebellious part is actually a very protective part that's, kind of popping up at nighttime and saying, we can't do this anymore. We need to eat.
Right. And you're anti-diet for what reason exactly? Because me, I'm a serial experimenter. I love A/B testing. I love seeing like the effect of things on my body and observing and hopefully choosing the right decision. So what is the definition of diet and why are you anti-diet?
I'm anti-diet because, well, for a lot of reasons, I suppose. Dieting is one of the primary ways that people often actually spiral into an eating disorder. So it's one of the most likely ways people actually end up with an eating disorder, that they've started with dieting. It's a risk factor for a lot of people. And so, of course, that's not to say everybody. Some people can diet and experiment and enjoy those different lifestyles that they encounter, and that can be completely fine, for some people. And of course, I'm all for autonomy. I'm not going to tell anybody what they should or shouldn't do, with their body and their relationship with food and their life. It's all for us, to personally choose. But what I can say is what we know from the research, that most eating disorders start with dieting. Dieting is a big risk factor for developing disordered eating for a lot of people. And at the end of the day, I think it's much more important to have a peaceful relationship with food rather than a particular kind of body. We all have aesthetic goals, of course. We all feel the pressure of wanting to look certain ways, and we all look around and we all evaluate ourselves based on what we see and all of that sort of thing. But I advocate for an anti-diet approach simply to bring more balance into the picture and to say that we don't need to be a certain size or weight or shape in order to still pursue health. Pursuing health can look like a lot of different things. And it's not necessarily about how we look, which is going to, determine our health, certainly not physically or mentally.
So is the right approach to do your research and A/B test stuff on your own body and take notes and observing the emotions and the psychology as well and your energy levels after, before, and during eating, something like that?
That's a really good question. I guess I mean, even that phrase "do your research" is a bit of a loaded phrase these days when it comes to this age of information. I think that it is for each and every one of us in our lifetimes to understand ourselves, and so in a way, yes. I think taking a scientist's mind to this and experimenting with what works for you. I think that that's a really good approach. I guess what I would suggest for people to do is um, to kind of examine what their motivations are, for the decisions that they're making. I think experimenting with what works for you, being genuinely curious about that, I think that's a really positive mindset to have. And really, that is like one of the cornerstones of intuitive eating. It's about, being genuinely curious about what works for you, listening to your body, taking that information as information, and trusting it, building that sense of trust within your body. That's what intuitive eating is about, and that's all about experimenting with yourself and being curious about what works for you, and making things not right or wrong, but just letting it be. I think that that's a really positive frame of mind to have, towards developing a positive relationship with food. Um, you know, do we want to suggest that people could or should experiment with food in a way that they test different diets and see what works for them and all of that sort of thing? Look, I think that that's a point of self-knowledge. It's not something I would necessarily advocate for people. I don't think, it would be antithetical, essentially in my position as somebody who works with eating disorders, to suggest that people would do that, but I can't say that that's not right for people, because I'm not the boss of of any individual person. You've got to find what's right for you, and if you find a particular way of eating that works for you, and that works, I mean, who am I to say? I think that's good. And I mean, the conversation about food, it really extrapolates out to everything in life. I mean, this is why I find the work that I do so interesting, is because I start with my clients talking about food, but it never ends there. Ultimately, we end up talking about all things related to things like self-care, self-esteem, self-worth, our ideas about, how much control we have in life versus how much we can just let go and accept the present moment. There's a lot of like an existential base of conversation there when it comes to food, because food is something that we have to engage with. So it really brings out, a lot of angst in people, a lot of existential angst even. So I think you have to find what works for you. I think if experimenting feels right, do that, but be mindful that dieting is a really good way to develop an eating disorder. And so if you're somebody that might be vulnerable in that space, there's a word of caution there as well.
Yeah, well, I've certainly known people around me that have been yo-yo dieting, like the Weight Watchers thing. And I
Mm.
think at some point in life, it's about the psychology directed at food, like you view food as something that is scarce and you absolutely need to get over with it. Then do you view food as fat that will go back into you and make you look ugly? Me, I certainly view it as fuel, as an endurance athlete, and just know that whatever I eat, I'm gonna burn it all. Still, I need to be careful not to eat too much sugar. Sometimes when I eat too much sugar, I feel like a throat pain, like I'm not sure what that's related to. It's maybe like gastric
Hmm.
gases or whatever. Um, but I think the advice that I give to these people sometimes is, at this point, you're like 65 or something like that. Just chill, enjoy the food. You've already tried changing, um, and then the consequences of that, the flip side is like if you're obese, well, at any time you might go, you will suffer. You'll have all these health problems, diabetes, arthritis, like all these autoimmune disease and so forth. So I guess it's a choice to be made. How do you view that?
Yes, I think we want to be, careful about making, correlation equal causation in that space. Um, we know that being in a larger body, having excess weight can be correlated with certain kinds of diseases, but it's also not necessarily. People can live in larger bodies and be free from health issues. And likewise, people can be in smaller bodies. People can be in the, so-called, healthy weight range of the BMI scale, or they can even be underweight, and they can have health issues such as diabetes and, heart issues and all of that sort of thing. So we want to be careful about, I think, making, sort of complete statements about that sort of thing. The picture of health is much more complex. Than sort of this black and white view of, being in a larger body is bad, being in a smaller body is good. Like we want to be careful about that. I guess the next bit that I would say is that weight for most people is not as controllable as we necessarily, I suppose, are led to believe it might be. And I mean, that can simply be evidenced in the fact that, if diets worked, if people could control their weight, there would probably be no people in larger bodies in the world, but that's not true. So weight isn't as in control, as in our control as we want to believe it is, and that's because it's just influenced by so many things. Lifestyle factors. What we eat and if or how we move. Those are just one component of weight, but things like genetics, of course. Dieting history is a huge one. If a person has like a long history of a lot of yo-yo dieting, that's a really good determinant of actually becoming larger over time, because there's a lot of metabolic damage that's done there. Things like medications, other health conditions, certainly mental health conditions. There's a lot of things that contribute to what a person's weight is that actually are not necessarily, in exactly our control. And so I think we want to look at the things that we can control. We want to look at, improving our relationship with food, improving our relationship with exercise. If you're somebody that doesn't exercise at all and you want to incorporate that so as you have better mobility, better flexibility, better agility, then looking at that for reasons that it's going to improve your life rather than help you lose weight, is a really positive way to look at it, because we can't necessarily control what our weight's going to be, but we can control what we do lifestyle wise, and not obsess about the number on the scale.
Think at some point, if you're human, you need to ask yourself if you're here for, I don't know, like pain and improvement or comfort, and both decisions are fine. Like me, I can't ever see myself getting fat just because I've chosen pain, and like constant suffering. And I find a lot of wisdom into that, but I also respect the comfort path. And I think that a lot of people, they haven't taken a decision and they're in between, and I think you just need to take a decision and sort of try to calculate like the outcome of these decisions. For example, it's not all about eating McDonald's. At some point you might get a similar amount of comfort and pleasure eating a burger that you built with your hands, and that is a bit more organic. So it's about a bunch of decisions. It is complex. I think when it becomes toxic is when you, for example, you binge eat and you eat, and you just feel shame while doing so. There's like
Mm.
no pleasure in eating anymore, and so there's and then as a result, you gain weight and you have all these disease. So if I ever come to these negative patterns in my life, can hypnotherapy help me? And if so, how come?
Mm. Um, so, yeah, and you've made some good points in there, I think. Hypnotherapy. So, as a hypnotherapist, I use hypnotherapy essentially to help people to understand themselves better, and to get to some of the goals that they are wanting to achieve. For me, as an eating disorder specialist, also, um, I encourage my clients to not make weight goals because, again, I don't think that the exact number on the scale is necessarily something that we can control. But what we can look at is improving our relationship with food, understanding why we might restrict food a lot, understanding why we might binge eat. We can work to understand a lot of these elements of our relationship with food, with body image, with exercise, and hypnosis can help people to understand themselves better. So I do a lot of what you would call parts work or ego state, kind of work where essentially I work with a person in such a way that we speak directly, to the parts of them that are doing certain things in their lives that they're not happy about, and we try to figure out, some conflict resolution. Essentially, when somebody comes into therapy, they're always coming because they are not happy with some part of themselves. It's the part of them that brought them into therapy is usually not the part of them that's doing the problem. And so we compartmentalize ourselves in this way, and hypnosis can help people to understand those parts better, create that better relationship amongst those parts, and hopefully come to some resolution inside where um, all of these parts start to treat each other better and actually come to some collaborative decisions about how to live life.
Right. Well, thanks for today, Bianca. It's quite interesting to learn about all of what you're into and freedom from food. It's quite interesting to discuss about these topics. I don't often get to discuss that. Where can people find out more about you?
Yeah, so you can go to my website, which is freedomfromfood.com.au. Of course, I'm in Melbourne, Australia. I run sessions in person here or online, so that effectively means that I do see clients from around the world as well. That's not a barrier. In terms of social media, Facebook and Instagram kind of are my biggest ones. Um, you can find me mostly on Instagram, really, which is at the Hays Hypnotherapist. Hays is HAES, which stands for Health at Every Size. So the Hays Hypnotherapist is where you'll find me on Instagram.